how much you know about Iranian social workers' activities in Corona situation. In the name of God, I'm talking about social work activities in Iran and West Asia during the COVID-19 pandemic. First, I show respect to all noble people who helped people in this hard time and lost their lives and their families, and I present them this flower. I appreciate organizer of this program, especially I appreciate the President of Japan Federation of Social Work and Dr. Mariko Kimura. We present in two parts. First part is about Iran that I present. Second part is about some countries in West Asia that my dear friend Mr. Olamaee present. Human beings experience different conditions during their lifetime following to different crises, including economic, political, military, natural, and medical disaster, the same coronavirus. Lived experience shows that type of reaction of people is related to different factors, including the following items that you know them too. Extent of each crisis, vulnerable people in each crisis. After that, effects from crisis, individual, family, and community, abilities and capacities for timely response. Another thing, efficient management and coordination between responsible organization, and then to have expert and enough human resource for timely response. People's resilience and participation, after that having similar experience in previous crises, and then appropriate policies for each crisis. After that, I explain public confidence in policy makers and senior manager in each country, province, and region. Existence of appropriate infrastructure in each country, and use previous experience for each new crisis. After that, to have expert and enough human resource, proper study of the effects of crisis on different aspects of people's lives, trust between people and government. I believe this is very important. The outbreak of coronavirus is one of these crises that, because of different reasons, including universality, lack of treatment programs, affecting all aspects of economic, political, scientific, mental, and social health, family and family relations, and etc., has unique features that are still ongoing. Social work in Iran during the coronavirus was very active. In this difficult situation, I believe all countries have experience. Iran is also one of these countries that has been affected a lot by the crisis, and many people have died, near 60,000 people in some day one person died every 3 minutes. In the same way, it has different experience and different groups were providing services in this condition. Iranian social workers were also present in different centers and areas from the very first days. Here I will mention some of these activities and experience. I hope it can be useful for you professors and experts. Iran Association of Social Workers has tried to fulfill the role of social workers in the corona time by observing a few points. I explain about these points. Presence in the fields of national and provincial policy. I believe that if we don't present in this area, less attention will be paid to social services and social workers. Although it is difficult to enter this field and senior managers are usually present, but efforts should be made to consider social work in making decisions and policy. A good or bad decision can increase or decrease the opportunities to use the capacity of social workers. After that, I believe that trust building before the corona crisis is interaction with the country's senior officials in various fields was very effective in creating these opportunities for the association and social workers and target groups. Wherever there was trust building, this space was provided more. Several actions were taken in this regard. Meeting with the President and discussing issues related to the target group of social work and raising the demands of the social field and the concerns we had. Also, it was an opportunity to make suggestions to the President, who is also the head of National Task Force for Management of Corona. The national staff also managed the corona. Let's present it. It was effective and hard and had results. Numerous meetings in the Parliament and its various commissions. Due to the extent of the corona crisis, all elements of the country are involved in this issue. Representatives of the people in the Parliament can also help because of their responsibilities. So, an attempt was made to raise the concern and needs of the social sphere in face-to-face meetings, and by second, numerous communication to continuously remind the importance of paying attention to the target groups of social work, as well as to be demanding. My presence as an advisor to the Social Commission of the Parliament in the previous 3-4 years terms, and now the new term is an opportunity for me to follow up these demands and concerns. After that, continuous communication with the Ministry of Health and the provincial corona management task forces. Since the Ministry of Health has an important role in providing services and management of corona crisis. Social work colleagues try to provide social support to patients and their families and to write and communicate instruction in cooperation with Iran Association of Social Workers and University. This relationship was not only at the national level, but also in the provinces, because some decisions were delegated to the provinces. In addition, lived experience has showed that depending on the circumstance of each province, there may be different needs and problems that should be considered in planning. Communication with the city council, some duties regarding homeless people and beggars, street addicts, and etc. Were assigned to the municipalities. For this reason, we tried to be present in the planning of this field as well. Another activity, communication with other areas related to making policy in Iran, including the judiciary, the police, the Red Crescent Society, and a special education organization. We tried not to neglect any influential capacity in policy making, because any capacity can provide a new opportunity to develop social services and social work so that people can use these services more. Although it took us a lot of time, we consider this attendance necessary. Attending the policy-making meetings of different organizations in the context of Corona was another program and activity that we conducted continuously to advise on making better decisions. It took us a lot of time, but as it was necessary, we went and attended. In addition to paying attention to policies, we needed to have the presence of social workers to provide direct service to patient, family, and people. Another point, in the field of providing social work services, the efforts of social workers in Iran were not limited to participating in policies, because the result of policy must be reflected in practice and social work services must be provided. For this reason, from the first days of the corona outbreak in Iran, social workers have been active and still are active in the public, non-governmental, and private sector. According to the target groups of social work in Iran, this presence includes the following groups and organizational areas: children, child laborers, street children, children in conflict with law, abused children, waste picker children, children without caregiver, children with effective caregiver, ill people, homeless, beggars, drug abuse people, people with disability, head of household women, refugees, criminal laborers, students with special needs, people affected with HIV and AIDS, abused spouses, abused elderly, abused people with disability, special and rare patients, immigrants, runaway people from their homes, socially disadvantaged women, poor family, psychotic patient, families with disputes, person with tried suicide, especially in crisis situation, policy clients, court clients, people living at informal settlement, family of prisoners. If we take a good look, we can see that social workers in Iran have been and are very active in the corona situation, and sometimes the fatigue caused by work was quite evident in their faces. I reiterate that social workers were not only employed in government center, but also in non-governmental and private center. The presence of social workers in deprived areas and informal settlements and the needs assessment they did was another important task that was done, because some people could not go to the service center. Therefore, this presence caused the primary health services and social support by available to them. This widespread presence has led to more and more attention being paid to social work. However, we are still far from reaching the desired point. Social workers use different methods of individual, group, and community work, and etc. In providing services for people in difficult situations, such as homeless addicts or people with special needs, and in more critical situations, and etc., the case management file was formed. I believe forming case management file for providing coordinated services with unit management is still not fully implemented, which in critical situation can reduce the worry of not receiving services on time. I believe these services were not only in person, but also telephone counseling and intervention with use of virtual networks was also of interest, because in this period it was not possible to visit in person due to coronary condition in many cases. For this reason, other methods of providing services were also used. Social workers were directly involved in providing services on several telephone lines, such as 123 Social Emergency Program, 1418 Voice of Consult, 197 is about health line, 4030 is a special telephone system for the corona situation, 09628 is national addiction lines. I would also like to explain that the telephone lines of the private sector and various specialized associations such as Elderly Association, Association of Social Workers, Association of Children, Association of People with Disability, Psychology and Counseling Organization, Association of Educational Psychology, Association of Rehabilitation Centers, especially to provide telerehabilitation services, and etc. were also active. Another point, in the field of education, I think you agree with me that in situations of various crises, the same corona, including coronavirus, social workers and people may face issues that need training. For this reason, holding virtual training courses and in limited cases with observing health protocol in person for social workers was one of the good programs. This training including various items, some of which are general and specialized training in social worker, self-care training for social workers so that they do not suffer from burnout and compassion fatigue, as well as for families. I believe this skill is very, very important. Professional ethic training in social work in Corona, training for families to manage conflicts and reduce tensions between parents with each other or with children, because we have not had the experience of staying at home and being together for such a long time, for so many years. Training for families to play group games, indigenous games, easy and free of charge games, and for children. I also find it necessary to explain that for the training for social workers, it was right that this training be tailored to their needs, because a number of people working as social workers in Corona did not have social work skills. Efforts were made to provide them general social work training virtually. These people were working directly with social work target groups such as street addicts, street women, street children, homeless people, refugees, foreign nationals, and etc. Part of this training were aimed to make social workers more familiar with the law, social resource, and responsibilities of related organizations so that they could refer people if necessary. Another point, appointing supervisors for social workers. I think you have the same experience that happen in crisis situations where we may need to connect with someone who has more information than we do. For this reason, we had appointed about 200 professors and experts in social work and some course in the field of psychology, counseling, educational science, family, children, cyberspace, and etc. That social workers from all over the country were able to call their mobile phones if needed and get the necessary instructions. I think it was a good action, and we had very few similar reports from other countries. At least I did not hear. It was a new capacity to better manage services in crisis situations, including the corona crisis. These people cooperated voluntarily and for free as supervisors and by the invitation of Iran Association of Social Workers. I believe it was a good experience for Iranian social worker in this situation. Another point, in the fields of research, we was active. We did not limit our presence to the activities that I mentioned. Also in the fields of research, a wide range of activities was carried out by social workers. Because based on research findings, more realistic planning based on objective evidence and be done. We both did research and used research findings to support needy individuals and groups. Some of the research findings of Iranian social workers and the association were published in international publication. Also on the website of the International Federation of Social Workers. I explained another point. In the international field, we have done several things, several activities that I will mention. Cooperation in making the guidelines of professional ethics of social work with the International Federation of Social Workers. Another thing, holding several virtual meetings with the Secretary General of the Federation, Dr. Teruel, holding several meetings with members of the Ethic Committee of the Federation. Another activity, holding several meetings with members of the UN Committee of the Federation. Holding a meeting with the President of the International Association of Schools of Social Workers, Dr. Olamaee. Holding meetings with the presidents of social work associations of different countries, including Russia, Italy, Armenia, and etc., with the aim of exchange experience. Presenting it at the online international conference of One Belt, One Road, organized by Chinese Association of Social Workers, with subject of social work activities during corona crisis in Silk Road countries. Presence in the media, I think, is very important. Undoubtedly, one of the most important capacities for informing the people, attracting the participation of the people to cooperate the corona situation, demanding and presenting suggestion or criticism is various media, including radio and TV, press, news agency, and visual media groups. I must say we had the most presence and we were able to be effective, making the campaign of I have good news in collaboration with the International Federation of Social Work, Asia Pacific region of the Federation, and the International Association of Schools of Social Work. In this regard, since 11 months ago, we have been publishing good news every week on Iran radio and TV, because I believe, it's my idea, we need to republish good news, even small ones, in items of crisis, which helps the psychosocial well-being of the people. Another activity in this situation, recording the lessons learned by social workers in another programs that we have because this experience can be used in the future for professor, participationers, students, related managers, policy makers, and etc. And we consider them an asset to society. We have another activity, for example, continuous communication with social workers in different organizations, in person, by phone, and virtually was another program that we was done. Sending commendation plugs to social workers active in the field of corona in all around the country by the association. The aim was that they realized that their effort visible. Another activity, making many corresponded with the parliament, government, and various organizations, and etc. for hiring social workers. In response to remote education challenge, providing 12 hours video training, 48 sessions for 1.2 million teachers and school counselors. They had to watch the movie, take final exam, and get certificates. Conducting 6-hour video training for a student and their parents with subject self-care and life skill in crisis situation, specific about corona situation. During the Cancer Week, in collaboration with Royan Research Institute and Razavi Charity, the association made online training for patient, family, and officers involved in dealing with cancer for coping with corona situation. Thanks for your attention.
Warm greetings to our Japanese social work colleagues from Tehran. In the second part of this training, I'm presenting about some social work activities in a few Western Asian countries, including Lebanon, Palestine, and Yemen. First, I start with Lebanon. Let me tell you some facts about this country and some backgrounds. Lebanon has 5 million people population, while 40% are Christian and more than 50% are Muslims. Lebanon has experienced civil war, and occupation by Israel. Lebanon is hosting hundreds of thousands of refugees from the neighboring Palestine and Syria. On 4th of August 2020, in the middle of COVID-19 crisis, an explosion happened in Beirut, the capital, which destroyed more than half of the city. So far, as of January 2021, there were 265,000 infected people and more than 2,000 death cases. Some social backgrounds about Lebanon. Some additional crises are added to the complexity of response to COVID-19 crisis and affected also the status of social workers working in the response on different levels. The economic crisis, political challenges, refugee crisis, and Beirut explosion. COVID-19 in Lebanon. On January 2021, the government of Lebanon urged people to stay home. A full lockdown is in place until at least mid of February 2021. This lockdown reduces the number of cases from one hand, and on the other hand, millions of Lebanese residents are at risk of going hungry due to pandemic-related lockdown measures. Some social workers faced with some challenges during working in COVID-19 situation that the Lebanese Association of Social Workers found out about them by an online assessment. Some of these challenges were as the following. Challenges related to work from home approach, lack of credibility of the information because of difficulties to do home visits and direct contact with the beneficiaries, lack of specialized resources and services for referrals, lack of mobility leading to reduce the direct contact with the beneficiaries, and lack of engagement of the beneficiaries, especially for services not related to distribution of basic needs. Now, speaking about social workers' actions during this situation. The social workers suggested a set of different types of support, including training and webinars on latest trends and intervention in response to COVID-19, mentorship and coaching, training on COVID-19 response and soft skills training via online platforms, creating a national platform to support the social workers on psychological level, creating a coping mechanism between the civil society organizations in order to post-crisis needs and criteria, a lobbying group to promote for regulatory laws, creating coordination mechanism between social workers to improve the referral system, creating a national platform for networking and coordination with the relevant stakeholders, and participation of the social workers in development of the post-crisis plan as main actors. Now I'm mentioning some social workers' achievement during this situation. Networking between social workers has increased. Awareness raising through social workers' intervention was more than before. Using online platforms for social interventions, for example, for working with sexual gender-based violence cases, child protection cases, counseling, case management, and mental health. Reducing uncertainty and stress impacting academic performance and impact on well-being. The second country which I am going to present about it is Palestine. This country has 5 million population, is a non-member observer state of the United Nations. It is under occupation since 1948 for more than 70 years. Widespread in severe poverty, 154,000 infected cases and more than 1,700 people are dead as of January 2021. 70% of local economy is dependent on tourism, and 9,500 social work members of the National Association of Social Workers. Speaking about the social background of Palestine, it is noteworthy to mention that living in Palestine is very similar to living in a big prison because of the occupation. The segregation walls and so many Israeli checkpoints, they were isolating all Palestinian cities from each other. Actually, Palestinian people are quite used to live under restrictions on movement and staying long hours at home for many decades. Palestinians have very strong family relationship and contact even with their extended families, so that they get used to visit each other often. Family and social gathering is an essential part of Palestinian local habits and culture. Well, speaking about COVID-19 in Palestine, I should say that the virus arrived via a group of Greek tourists first to the city of Bethlehem, the administration center of Palestine, because Palestine was welcoming tourists until the last moments because of the dependency of the country economy to the tourism. Then severe lockdown started with exceptions of healthcare centers and food shops. The government, in collaboration with some counseling and family supporting groups, including the Palestinian Union of Social Workers and Psychologists, they formed a supportive committee. Some challenges of social workers working in this situation in Palestine were that they had difficulties accessing to the people because of not only the COVID-19 lockdowns but also to Israeli restrictions of movements. A lot of psychical and physical traumas of people following to the decades of occupation, extreme poverty and rate of unemployment, very crowded environment of Palestine, and following social distances is completely against the strong family ties in Palestinian culture, which needed a lot more efforts from social workers to convince people to follow the social distancing. Some social work actions in Palestine during COVID-19. Social workers were an essential part of crisis plan in Palestine. They provided information for decision makers, spewed out online sources of posters, guidelines, manuals, short videos and articles understandable by everyone about the virus, protection rules, and hygiene information. They provided counseling and disseminated information regarding from where to find sanitation and how to use it, how to deal with children and other issues during the pandemic. Social work groups provided 24 hours hotline services with numbers of consultants to provide advices and counseling for those who in need. Social workers try to make sure that sanitizers are always available. Social workers contacted the infected persons to make sure that they are all right and they are able to continue the isolation in good and healthy well-being. They try to reach also the family of infected patients and help them to overcome this hard time, in addition to consult them on how to deal with the situation on social and psychosocial level. And fair delivery of donated health tools, food, water, and other medical needs and hygiene sanitizers between the people. The third country that I'm going to speak about it is Yemen. This country has 29 million people population. This country is in civil war situation and under attack by Saudi Arabia and UAE forces since 2011. 85% of population of Yemen are in need of humanitarian aids. Yemen actually is one of the poorest countries in the world. Humanitarian access, in the other hand, is blocked because most of the sea and airports are blocked by Saudi-led forces. As of today, in January 2021, more than 2,000 infected and more than 600 dead cases have been counted. Regarding the social background of Yemen, it's noteworthy to say that about 36,000 people have fled to other countries following to the war situation, but millions of people are actually trapped inside the country and unable to leave. And estimately, there is 3.6 million internally displaced people in Yemen who are living in crowded, derelict shelters or damaged homes. Because of war, approximately 17 million are in desperate need of food, and almost 100 civilians were killed or injured every week. This is the statistics of 2018. Severe outbreak of COVID-19, cholera and other communicable disease, and also a high risk of famine. UN's humanitarian response plan for June through December 2020 is facing a shortfall of more than $2 billion. Speaking about COVID-19 in Yemen, it is important to note that more than 50% of the country's health facilities have either been destroyed or damaged due to the conflict. The number of confirmed cases is seriously undercounted due to the destroyed health infrastructure. Yemen authorities banned movement to and from the cities with the exception of the transportation of goods. Many Yemenis are with very weak immune system and lack of trust to the health system. A large portion of the population are not taking awareness messages transmitted through TV, social media, and from the Ministry of Health via text seriously. The limited food, fuel, and medical supplies are still available are too expensive for families to purchase. This is a burden on social workers on how to fairly distribute the few available supplies. Restriction of movements and big gatherings, armed conflicts, flood, and lack of necessary infrastructures makes it more difficult to distribute items. Lack of access of people to media and other dissemination means also makes it more difficult to deliver information. What did social workers do in Yemen during the corona pandemic? It was supporting quarantine centers by providing non-food items including blankets, mattresses, sleeping mat, and solar lamp. They developed a case management system for vulnerable children in accordance with the Ministry of Labor and Social Welfare. The Yemeni Association of Social Workers has conducted a social media awareness session, a series of these sessions in all apps of social media, including Facebook, Twitter, Instagram, YouTube, and WhatsApp. In collaboration with the Ministry of Labor and Social Affairs, they worked in all levels of central, governorate, district, and community. In the central level, they worked as national consultants and they worked in the central operating rooms and hotlines. In the governorate centers, they worked as supervisor of emergency responses, and in districts and communities, they provided awareness, psychosocial supports for families and communities.